So, Andrea, welcome back.
Thank you.
How you doing today?
I'm good. I'm great.
Good. So the last time I saw you, we had done a little bit of liposuction on you, on your arms and some of your inner thighs and outer thighs. And did you have a pretty good experience with that?
I had a great experience, especially with my arms. I actually went to a different plastic surgeon who said he couldn't do the arms, and if he did do the arms, I'd have a lot of excess skin that would sag, and we didn't have that happen. I had a great success with the arms, so I'm very pleased.
Good, good. Yeah, I know we talked about that before. You know, it's interesting with liposuction, the way that it's evolved over the years. Whereas, you know, historically in surgery, a lot of patients like you probably would have required cutting off the skin. We were able to get that skin to come up maximum amount with a minimally invasive procedure. So today, I know we're going to do some different areas. We're going to take a look at your calves and ankles. So tell me kind of what is exactly bothering you there.
Well, a lot of my fat actually goes to my ankles and my calves, and no matter how much exercise I do, I can't get the fat to come off, and therefore I can't wear skirts or shorts, and it's really affected me.
Yeah, is that a genetic kind of pattern? Is your any sisters or mother?
I think my mother
yeah.
actually has the same thing.
Yeah, it's a tough area. It's a very tough area. It's one of the most challenging areas that we see through here because it's extremely difficult to get rid of. I don't know of an exercise that could possibly get rid of fat on selectively on your calves or ankles. So we'll get you up here in a second. We'll take a look at that, and this will be a much easier process even than what you went through before. Your recovery is pretty minimal, and it involves some very precise micro-sculpting. We'll use even smaller instruments than we used before, but we get great results with calves and ankles. And I'll show you when we stand up. I'll draw on you and show you exactly how we're going to reshape them and give them a more normal feel for you. Okay?
Super. I'm excited.
All right.
Thank you.
Yep. So now we're going to draw on you and determine exactly what the map or the surgical plan is. So a couple things that we're going to do. We're going to blend this area a little bit better and take off a little bit of this fat pad to give the lower leg here a little better look. We've got to be careful. We can't do the top of the knees. When you attempt to do liposuction of the top of the knees, it ends up with a lot of loose skin. So we just blend through here, and then we'll take off a little bit of this knee pad right there. And then what we're going to do, when I look at your, maybe just stay nice and straight. When I look at your legs here, there's a couple things with the calves that give them a slimming effect. One, will create a little bit of an indentation there. She also needs to be debulked here a little bit. And then we come down to the ankles. And the ankles are a very important area. We want to be able to better see this bony prominence that gets a little hidden there in the fat pad around the ankles. So I'm going to make little incisions right there and there. And the same thing on the outside. Okay, now, if I could have you turn all the way around and face the wall. Good. Slim that down there. You can see we want the calves to taper as they come up, and right now they're pretty consistent all the way up. So we'll create a little indentations there and there. All right, I think we're ready to get started. So during this part, we're just going to make our little incision points, and we're going to fill things up with the local anesthesia. Same thing that you went through before. Yeah, local anesthesia burns a little bit, a little poke here, but
I can't even feel that.
it gets numb. It gets numb quick, and this allows us to do it under local anesthesia while you're awake. It's really the only way to sculpt areas like this, because I'll have to stand you up at the end and make sure we got things right. think you'd mentioned you'd had your ankles done one other time and it just wasn't very thorough. You know, that can certainly happen with any liposuction, but you just give yourself a much better chance for success when you have an awake patient that you can really see the proper anatomy. That I can stand you up and see you in the proper anatomic position. So, this is just a little lidocaine. And the beautiful the reason that we do the procedure this way is we use such tiny little incisions with this 2mm punch biopsy that we can really put incisions anywhere and they heal up so nice that 6 months to 12 months later, maybe 18 months in some cases, you'd never even know we did surgery. But it really allows us the proper access that we need to get a good surgical result in difficult areas. Alright, so now we're going to put in a little bit of that local. So you'll feel a little burning here. So areas of the skin turn real white because we've injected the medicine to numb the areas, and it also shuts down those little blood vessels, so there's hardly any blood loss with the procedure. But this really, since she's awake, I can feel that she has muscle tone. It allows me to really do a nice, accurate job when we take out the fat. So, just makes it, like I said, just makes it a much more accurate procedure because calves and ankles they're difficult areas to liposculpt. You doing okay?
Doing great.
So we just, you know, like with any sculpting procedure, whether you're working in clay or working in wood, you just kind of piece away little bits here and there, and then you reevaluate and you take a little more and keep shaving away. What we're going to do now is I'm going to probably stand you up and take a final look, but for the most part we got about a good 1.3 liters off. So
great.
You did great.
Thank you.
Just like before, congratulations.
Thank you. It's great.
So these areas will swell, we'll get them all wrapped up, and then we'll get you on your way, and I'm going to see you back in a week, and we'll go from there.
All right, thank you.
You bet.